Hi everyone, welcome to webinar 5 in our data exchange webinar series for the Targeted Early Intervention program. In today's webinar, we are going to finally start talking about data entry, so creating cases, sessions, and clients. As always, there are 3 key topics we'll discuss. So first, I'm going to introduce you to some of the DEX jargon about cases and sessions. We'll talk about what these actually are and how we use them to report our activities in the data exchange. Then we'll talk about the different kinds of clients you can report in the data exchange and when you should have individual clients or unidentified groups of clients. And then we will also discuss what information you need to collect from your clients in order to record them in the data exchange. So, as always, in our previous webinars, I've introduced everyone to this document, the Data Exchange Quick Start Guide. This is a 5-page document that outlines the 11 key steps you need to follow to access and start using Data Exchange. It includes links to all of the key resources you need to complete each step. And as you can see on the slide, it includes a checklist so you can keep track of where you're up to. So in each of our webinars, I've been taking everyone through each step in this document. So we've accessed training materials, we've subscribed to the newsletters, we've created our outlets, and we've looked at our consent and privacy principles. And in today's webinar, we're going to cover step 8 and step 9. So step 8 takes you through what information you need to collect from your clients to report in the data exchange. So in the TEI program, there is a minimum data set that we expect all organizations to try to collect. So I'll take you through that data set and hopefully give you a really good understanding of what information you need and when to collect it. And step 9 is where things get really exciting. We can finally start talking about reporting, about actually entering your data into the data exchange platform. So in this step, I'll take you through how to set up your cases and your sessions and your clients. And I'll give you a number of different examples to help you figure out how to do that for your specific activities. So to get started, I want to cover off a lot of the jargon that the data exchange uses. So in the data exchange, there are 4 key things we need to create in order to report on our activities and our clients. So the first one are outlets. So that's the location a service is created. That's the location a service is delivered in. I'm not going to talk about outlets now because I went over them in a lot of detail in one of our previous webinars. So if you don't know what outlets are and your organization hasn't created these yet, please see the previous webinar on setting up your organization and creating outlets. Once your outlets are ready to go, then you can start creating cases. So cases store information about program activities and outlets. And as you can see in the diagram, they link relevant sessions together, and which then link clients together. So they kind of act like a container for the specific activity that you deliver. Once you've created your case, then you can start to create sessions. So sessions are individual episodes of service. So every time you meet with an individual client, a family, or a group, you will create a session to show that you delivered a specific activity on a specific day to a specific person or group of people. And then the last layer of data entry are our clients. So you can attach clients to a case to say these are the people who will be participating in this activity. And then you also need to attach clients to a specific session to show who actually participated on that particular day. Now, I'm going to go through each of those key components in a lot more detail. So when you create a case in the data exchange, this is what the portal will look like. You can see the screenshot on the right-hand side of the screen. So the first thing you need to do is create a case ID. So this can be anything you want. The only people who see the case ID are staff in your organization. So you should name your case as something that will make sense to you and your colleagues, but make sure it doesn't include any identifying information about your clients. If you want, you can leave the case ID blank and the data exchange system will actually generate a numerical code for you. The next thing you need to do is pick your outlet. So this is a drop-down menu and a list will appear with the outlets for your organization. So you just need to pick the outlet that your activity was delivered in. The next field is the program activity. This is also a drop-down menu, and it will display the program activities that have been assigned to the outlet you chose. So the outlet field and the program activity field are connected to one another. So from the drop-down menu, you can pick the relevant program activity for your case. The next field is the total number of unidentified clients associated with the case. In this field, you can record how many unidentified clients may attend your sessions. So this can be used to record large group activities where it's not possible to identify all of your clients, or a community event, for example. If the case relates to clients who you can identify, then you should leave that at 0. We'll talk more about when to use unidentified clients later on though. And then the last field is the attendance profile. So this describes the relationship between people in a case. So it could be a family, a couple, people who live together. I think another option is community event or a group of peers. So this is a drop-down menu also, and you can just select the option that best describes the group of people who will participate in your sessions. So once you have created your case, you can then move on to creating your session. So again, the image on the right-hand side is a screenshot of what you'll see in the data exchange portal when you start to use it. So when you do this, the first piece of information you can see is the case ID. So that's the name of the case that the session sits under. And then the first field you need to complete is the session ID. So similar to the case ID, this can be anything you want. You should name your session something that will make sense to you and your colleagues. The next field is the session date. So this is the actual date that the activity occurred on. When you create sessions, you can't create them before they occurred. You can only create them on the actual day or for a past date. This is to prevent people from creating sessions that they don't end up using. Once you've entered your date, you need to select a service type. So this is a drop-down menu, and you'll be shown the service types that sit under the program activity you selected when you created your case. So you need to choose the service type from the list that appears. And when you do this, you need to make sure the service type matches what is in your organization's contract. Don't just pick a random service type. It has to align with what you've been contracted to deliver. The next field is the number of unidentified clients who attended the session. So this field will actually only appear if you entered a number of unidentified clients when you created your case. So at the case level, you will enter the number of anticipated unidentified clients. And then at the session level, you need to enter the actual number of unidentified clients. It's also important to know that the maximum number you can enter here is the number you recorded in the case. So if more people attended an event than you anticipated, you need to go back to the case and increase the number before you can add it to your session. The next field is the service setting. So this tells us more information about the location the service was provided in. So as you can see, this is also a drop-down menu, and there are 9 different options for you to choose from that describe the setting of your service. So it includes things like your organization's office, a client's residence, online, over the phone, a community venue, the list goes on. So you can just select the service setting that best describes the location of your activity. And then the last field is whether or not an interpreter was present. So this is just a simple yes or no. In the TEI program, we don't have to complete this field, but if you think it's relevant to your service and it's information that you want to capture, then you can do that. So now everybody has a basic understanding of what cases and sessions are. I'm going to run through some concrete examples to show you how this actually works in practice. So on the slide, you can see now we have an example of an organization who has conducted 2 different activities. So on the left-hand side in the red, they've created a case for a NAIDOC event. So the outlet for this event is the hub, and the program activity is community connection. Because this is a community event, they've also recorded how many unidentified clients they think will attend. which is 60. Then they've created one session for the event. So they've included the date, and the service type is community engagement. And then they've also recorded the number of unidentified clients who attended, which was 48. And then on the right-hand side in the blue, we can see they've created another case. This one is for their playgroup. So this activity is also conducted in the hub. So that's the outlet they've selected, and their program activities targeted support. Now they've created two sessions, one for each playgroup they've conducted so far. So the first playgroup was on the 18th of November. Then the second playgroup was on the 25th of November. And they haven't recorded any unidentified clients because all of the clients for this activity will be individual clients. So they'll just attach them to the sessions that they attended. The next example I want to show you is also for a playgroup. But in this example, they've got two different outlets because they run two playgroups that are actually conducted in two different locations. So they have an outlet for each playgroup, which means they need to have a case for each playgroup, and then they create their sessions underneath that. The next example is a little bit more complicated. So for services who are working with the same person or the same family over an extended period of time, you can create a case for that family or individual. So for example, if you deliver counselling or if you do case management where you work with a family over an extended period of time, you can create a case for each family that you're working with. So in the example on the slide, this organisation has set up their outlet, which is their family centre, and they've currently created 4 cases, one for each of the families they will work with. And then they have created a session every time they meet with the families. So this can be a really useful way to manage a client's case. After you've been working with them for a while, you can just look up their case in the data exchange and see exactly what activities they've participated in and what outcomes they might be achieving. One other thing that I want to discuss about setting up cases and sessions is the number of unidentified clients you might record at the case level. So one of the really important things you always need to remember is that this number should be the number of unique people you expect to attend your sessions. So if we look at this example on the slide, we've set up a case for some parent information sessions that are held at a local public school. Now, the number of unidentified clients you record would depend on if the people who attend your information sessions are the same group of parents for all 3 sessions, or if it's a different group each time. If it's the same group of people who attended all 3, then the number of unidentified clients for the case would be 20, because 20 different or unique people are participating in your sessions. If it's a different group of people who are attending each session, then the number of unidentified clients for the case would be 60, because all up, 60 unique people would have attended a session. So this number actually acts as a bit of a safeguard to help us understand how many unique unidentified clients you're working with. And it's really important to get this right, otherwise your reporting will be off. So please make sure that you're thinking about the number of unique people you expect to attend your sessions when you figure out what that number is for your case. So they are just some quick examples that I have for you today. We have 3 more webinars on our website that go through different examples of how to set up cases and sessions. One webinar is for the community strengthening stream, another is for wellbeing and safety, and the third one is focused on sector coordination and planning. You can also check out this document on the screen, How Do I Set Up My Cases, Sessions and Clients? That includes a number of different examples that walk through how to report different activities. So please take a look at that document if you're a little bit stuck figuring out how many cases and sessions you should have for the services that you deliver. When you're ready to start creating your cases and sessions in the data exchange, there are lots of different resources you can go to for help. There are 2 task cards. So these 2 task cards. These are documents that take you through the process step by step. And there are also e-learning modules where you can actually watch someone navigate the data exchange portal. So if you ever need any help, please download these documents and take a look at those modules to get a better understanding of how to create your cases and your sessions. What we're going to do now is talk a little bit more about clients, who your clients actually are, and when you should have individual clients or unidentified clients. So in the TEI program, a client is a person who receives a service that is expected to lead to a measurable outcome. So this means it is someone who participates in an activity that you deliver that's been funded by the TEI program, and you expect to see a change in that client's skills or their behavior or their circumstances because of the activity you have delivered. So in the data exchange, there are 2 different types of clients you can report. There are individual clients. So this is any individual person who participates in an activity you deliver. You will collect personal and demographic information from them, and you will create a client record for them in the data exchange. The other type of clients we can record in the data exchange are unidentified group clients. So this is a large group of people who receive a service, and it's not practical or necessary to collect individual client information from them. So instead, you can just record the number of people who participated in the activity. Here are some examples of when you might have individual clients compared to unidentified groups. So you will most likely have individual clients for things like play groups, counseling, parenting programs, home visits or case management, group activities like a youth group or a parenting group, school programs. It's really going to be any activity where you expect to see your clients more than once. Unidentified group clients can be used for one-off occasions of service delivery. So when it's highly unlikely that you'll see the same client or the same group of people again. So you could use this for things like community events, maybe a large one-off information session for information, advice, and referrals. So when somebody calls up your center or just pops in for 10 minutes to ask some questions, for all of those fleeting interactions. You can also record unidentified groups when it's not really necessary to collect personal information from people. So we know a lot of TEI-funded organizations facilitate interagencies, for example. So when you work with the staff members of another organization for an activity like that, it might not be necessary to collect personal and demographic information from those people. So you could just record the people who attend the meetings as an unidentified group. And you can have a combination of individual clients and unidentified group clients. So if it ever gets to the point where at your interagency, there are a couple of people who want to provide their information and there's other people who don't, you can have a combination of that. To illustrate this a little bit better, here are some examples to show you when you might have individual clients and when it's okay to have an unidentified group. So for the first example on the far left, that is for a community event. So they expect that 300 people will attend this event. So it's not really going to be possible to go around to every single person there and ask them to answer a series of questions about themselves. So they can just record the number of unidentified clients. And you can see they've done that at both the case and the session level. Example 2 is for an interagency meeting. So here is an example where they've recorded a combination of individual clients and unidentified clients. So you can see at the case, they thought 5 people would be unidentified. At the session, there were actually only 2 people who were unidentified, and then they attached 8 individual clients to that specific session. And then our last example is for family therapy. So there are no unidentified clients here, and there are only 2 individual clients. This is because this is very likely to be a really intensive service. So you will most definitely see those clients on numerous occasions. And it's really important to have key demographic information about them so you can better meet their needs in the best possible way. Like I mentioned before, there are 3 more webinars that discuss setting up cases and sessions and clients, where we go through a lot more examples like this to help you figure out what you need to do for your specific activities. But again, please make sure you check out that document, how do I set up my cases, sessions, and clients? Because that includes a number of different examples that walk you through how to report different activities in DEX and when you should have individual clients and when you can have an unidentified group. So, as a general rule of thumb, you can use the information on this slide as well to help you determine if your clients should be individual clients or an unidentified group. So as you can see, the proportion of individual clients that we expect you to report varies for different program activities. So for community connections, only about 25% of your clients only really need to be individual clients. This is because the type of work that's conducted in that program activity is most likely to be with large groups of people or with a group you may not see again. And then it goes up to 50% for community centres and community support. And then for targeted support and intensive or specialist support, 100% of your clients should be individual clients. Please note, though, that this is just a guide. We understand that there are many situations where it may not be possible for organisations to meet these percentages, and that's more than okay, just so long as you're trying to record individual clients where it is actually possible. So now I want to spend some time talking about the TEI minimum data set. So this is all the information you need to report in the data exchange. So the table you can see on the screen now is a summary of all of that information. This table is available in a document called What Information Do I Need to Record in the Data Exchange? You can see the hyperlink on the top right-hand side of the slide there. In the first column in the table, we've got the case level and the session level information that you need. So we kind of went through that a little bit earlier when I talked about how to create your cases and your sessions. On the far right, you can see the client outcomes and community outcomes information. Please ignore that for the moment. We've got 2 more webinars coming up to talk specifically about measuring outcomes and using scores. So we'll wait until we get to that to talk about that. For the moment, what I want to focus on is the client demographics and needs column. So this is the information you need to try to collect from your individual clients. So as you can see, it is a very comprehensive list. It includes a client's age, their address, if they have a disability, if they identify as Aboriginal or Torres Strait Islander, if they speak a language other than English, if they're homeless, etc., etc. All of the items with the red asterisks are mandatory. So that means for your cases and your sessions, you must fill out those fields. For the client demographics, though, it just means that we must ask our clients those questions. However, we can never force a client to provide us with this information. We can never do that. We can never, it's not mandatory for a client to answer those questions, but it is mandatory for you to ask those questions. And then the items with the 2 black asterisks are part of the partnerships approach. So in the TEI program, we ask that you also collect this information because it can give you a really useful understanding about your client's needs. So when you add a client to the data exchange, you will see a bunch of screens that look like this. And you basically just need to go through each field and enter your client's information. There are some fields that are optional that you can use. So say, for example, a client doesn't want to give their real name. You can tick that box that says name provided is a pseudonym, which means the name you've entered isn't real. If the client doesn't know their exact date of birth, you can tick the box that says estimated date of birth. That will change the date of birth field. So you can just select the year that is closest to the client's estimated age. The last field lets you enter tags. So this is a cool way to help you search for your clients later on. They work like little search filters. So you could create a tag that is, for example, 0 to 5-year-olds. So next time you need to find one of the children that attend your playgroup, you can just search by the 0 to 5-year-old tag and you'll hopefully be able to find the client you need much faster. And you can create as many tags as you like, and they can be whatever you like as well. So you could create a tag for young mothers, for over 65s, for a specific suburb or LGA, whatever you think is going to be most useful for you. The last two pieces of information there are the two consent statements that we all need to ask clients before we can enter their name and address into the data exchange. We discussed this in our previous webinar, but if a client does not consent to one or both of those statements, then you just need to make sure you untick the relevant box. Please make sure you watch, if you haven't already, the previous webinar on consent and privacy for more information about that. Once you've completed that first page, you'll then be taken to the second page about adding a client's residential address. You can enter their full address, including their house number and the name of their street, or you can just enter their suburb, state, and postcode. It's up to the client about what information they want to provide you with. After that, you need to enter some demographic information. So this includes the client's country of birth and the language they speak at home. These are just drop-down menus with a very extensive list of countries and languages for you to select from. You also need to state if the client identifies as Aboriginal or Torres Strait Islander. Again, this is a drop-down menu with 4 different options. And then the last one is if the client self-identifies as having a disability. They don't need to be clinically diagnosed. If the client believes they have a disability that falls into one of those categories, then they can just select the relevant option. There are definitions for those categories in the data exchange protocols as well. If you need more information, if you need help working with your client to figure out if they do have a disability that sits under one of those categories. And if a client doesn't want to disclose that they have a disability, then you can just select the not stated option. And then the last page you need to complete is the extended demographics. So these are all part of the partnerships approach, but you do not need to collect all of this information. You only need to complete the first 2 fields, which are the homelessness indicator and household composition. So homelessness indicator is a drop-down box, and you can just state if the client is homeless or if they are at risk of homelessness or if they're not. And then the household composition is also a drop-down box, and you can use this to describe the makeup of the home the client lives in. So there are 7 different options to choose from, ranging from a single person household, a group household of unrelated adults, etc., etc. So you can just pick the option that best describes your client's living situation. You do not have to complete all of the other fields that are there about education, employment status, income. It's not mandatory for the TEI program. You are more than welcome to. I've spoken to lots of organisations who are collecting that information because they think it's going to be really useful for them to better understand their clients' needs and the challenges they face. They can make sure that they're addressing them in the best possible way. But in the TEI program, it is not mandatory. You only need to complete those first 2 fields for our program. So to help you collect all of this information, we have developed an example of a client intake form. So this includes all of the questions you need to ask and the response options that are in the data exchange platform. So you can directly enter the information a client gives you into DEX. You do not have to use this form. We know lots of organizations already have their own client intake forms, but I would at least take a look at it and make sure that your own client intake forms include the same questions and the same response options in here, so you can easily enter the information a client gives you into the data exchange. And this is available on the TEI website. And the hyperlink is in a later slide that I'll show you. When you're ready to start entering clients into the data exchange, there are a number of different resources you can go to for help. There is an Add a Client task card that takes you through the process step by step. And there is also an e-learning module or video where you can actually watch someone create a client record. So if you ever need any help adding a client, please see those resources. So in addition to the client demographic information, you also need to record referrals in and out of your organization. So when a client participates in an activity for the first time, or they come to your organization for the first time, you need to record the referral in, so how they came into contact with your organization. So this information is recorded at the case level. So when you attach a client to a case, you should also record the referral source, so how they came into contact with your organization. This is a drop-down menu with numerous options for you to choose from. The referral source could be from a health agency, an educational agency, the NDIS, it could be an internal referral. So maybe they've been referred to a specific activity within your organization, or it could be a self-referral or something like that. I think there's 20 different options for you to choose from. You also need to select the reasons why the client came to the service. So there are 11 different options for you to choose from, and you can select a primary reason and a secondary reason that best describes why the client came to your service, why they are seeking assistance. So this information is recorded at the case level. So if you need help figuring out how to record it, please see the task card, Add a Case. It includes a whole section on recording referrals into your organization. You can also record referrals out. So when you refer a client to another service or another activity, you need to record this also. So this information is recorded at the session level. So after you have delivered an activity and you attach your client to the relevant session, you can record if any referrals were made. So you need to enter the referral type. So this is just a simple drop-down menu that has the options of internal and external. So an internal referral would be if you referred them to another service within your own organization, and then an external referral would be if you referred them to another organization entirely. And then you also need to select a referral purpose. So why are they being referred to another service or activity? And again, there are 11 options here for you to choose from, and you just need to select the options that best describe the reason for the referral. And you can select more than one. I think you can select as many options as you need to. So, oops, sorry, the slides are stuffing up. Okay, so I know that was a lot to take in. So we have got this little cheat sheet to help you understand how to report all of this information. So you can find this document in this table, in the document I mentioned earlier. What information do I need to record in the data exchange? The hyperlink is at the top of the screen there. And it includes a list of all of the information to record, and then you can see the colored boxes show you the DSS resource that could help you figure out how to actually enter it into the data exchange. So if you ever get stuck, please download that document. What information do I need to record? And it'll tell you what data fields you need to complete, and it'll give you a link to a resource that can help you complete it. That same resource, what information do I need to record in the data exchange, also includes a bunch of different examples of exactly that, the information that needs to be recorded. So obviously a community event is going to look very different to information and advice, which will also look different to case management or a parenting program. So we've come up with a number of different examples to help everyone understand what information should be recorded for specific activities. So again, please download that document and have a look to get a better understanding of the information you need to include. Before we wrap up, I just want to show you guys some of the really great information that has already been reported into DEX. So when you start entering data and you access your reports, you will be able to see this same information about your own clients and your own activities. So you'll have an age breakdown of clients. You'll be able to see how many are homeless or at risk of homelessness, what disabilities people have, what languages people speak. And we can use this information to make sure we're addressing our clients' needs in the best possible way and that they're receiving the service that is right for them. This next slide is some of the referral information that's already been recorded. So we can already start to see how clients are coming into contact with TEI services. Some are being referred by health agencies, by educational agencies. There are lots of internal referrals and there are lots of self-referrals as well, which personally I think is a good thing because that means our program is functioning as that soft entry point that it's meant to be. And we can also see the reasons why people are coming to our services. And then across the bottom, those green graphs show you the referrals out. So whether or not our referral is external or internal, and the reason for that referral as well. So already we can start to see some really useful data about how our clients are navigating the service system and what their needs are. And this is only going to become more and more useful as we collect more data over the years. Here are all the resources that I mentioned today. So on the left are the resources that we in DCJ have developed. So please download these and have a read. They include countless examples of how to record information in DEX and what to record. And we update these documents all the time as well. So if you ever get stuck, please hop onto our website and have a look. And if you have any feedback on them as well, you can always email us so we can try to improve them as much as possible. And then on the right are all the resources DSS have developed. So these walk you through how to navigate the data exchange platform. And again, like if you ever get stuck figuring out what data fields to enter or how to enter them or how to capture your referrals, you can download those documents and it'll show you how to do it. And as always, here are all the different places you can go for help if needed. If you need assistance figuring out how to set up your cases and sessions, how many you should have, if your clients should be individual clients or unidentified clients, please come straight to the TEI inbox. If you email us here, we'll get back to you within a couple of days with an answer for your question. Awesome. Thanks so much, everyone. I'll see you in the next webinar.